Dr. Lee has gained widespread popularity for his groundbreaking research on angiogenesis and diet plans. Today, Dr. Lee will guide us through essential topics of the heart divided into 5 parts. Part 1. Visible signs that something might be wrong with your heart. Part 2. Classic symptoms you might feel when your heart isn't functioning well. Part 3. The most dangerous blood type for heart health. Part 4. How to maintain a heart-healthy diet.
Part 5. How to prevent heart health issues. Stay with us until the end. There's a lot you might not know, some of which could save your life. But first, please like this video. The more likes it gets, the more YouTube will show it to people who might not have access to doctors or hospitals. Also, share it with your friends and family. Your action could save lives. Let's get started.
Part 1. 7 visible signs of heart problems. 7th sign, diagonal earlobe crease.
You might start inspecting people's ears more closely from today. Why? Because a small sign in the ear could indicate a blockage in the arteries of the heart, the coronary or carotid arteries. This is known as Frank's sign, named after Dr. Sanders Frank, who noticed in the 1970s that many of his patients with angina, chest pain, had a diagonal crease in their ear. One theory suggests that the same factors damaging the inner lining of the arteries also cause this ear crease. However, not everyone with Frank's sign has a blockage. Out of 100 people with this diagonal crease, 30 have nothing more than a sign of aging. The younger the person with the crease, the more likely it is to be a sign of a coronary or carotid blockage. The sensitivity of this sign is low, so a smooth ear doesn't necessarily mean you're clear of heart issues. 6th sign, hair loss on the legs. Hair loss, starting on the shins and progressing to the thighs, can indicate peripheral arterial disease, PAD, which involves clogged arteries in the legs. Atherosclerosis is a diffuse disease, meaning if you have blockages in your legs, you might also have them in other arteries, including those supplying blood to your heart. Many people with PAD don't realize something is wrong until atherosclerosis has advanced. Hair follicles require nutrients and good circulation to grow. If your arteries are clogged with fatty plaque, blood and oxygen supply are insufficient. Besides losing hair on the legs, you might notice smoother, shinier skin, cold skin, and reduced nail growth. However, leg hair loss can also occur due to genetics or friction from clothing. 5th sign, xanthelasma. You might have seen yellow plaques on someone's upper eyelid. This is xanthelasma, a cholesterol deposit in the skin. It's more common in middle-aged women and usually appears in the inner corner of the eye, often on the upper eyelid. About 50% of patients with xanthelasma have dyslipidemia, high cholesterol, or triglycerides. Interestingly, only 1% of people with high cholesterol develop xanthelasma, but its presence increases the risk of heart disease, heart attack, and stroke. If you have xanthelasma, it's essential to get your cholesterol and triglycerides tested. 4th sign, arcus senilis. Arcus senilis is a white or grey arc that forms around the outer part of the cornea caused by cholesterol deposits. It is common in older people and does not affect vision or require treatment. However, if it appears in people under 45, it may indicate severe dyslipidemia, very high cholesterol and triglycerides, and an increased risk of heart disease. 3rd sign, cyanosis. Cyanosis, the bluish or purple coloring of the skin, indicates that part of your body isn't getting enough oxygenated blood. It could signal a blocked artery or a lung problem. If an area of your skin remains cyanotic when you're warm, it could be a serious issue. If you experience shortness of breath, along with cyanosis, it might indicate lung problems such as pneumonia, emphysema, pulmonary embolism, or heart failure. Second sign, ulcers that won't heal. Sores on the legs or feet that won't heal can indicate poor circulation, often due to low blood pressure from a blockage in the arteries supplying the area. These ulcers can make it difficult to walk fast, causing tired or sore legs and cramps. Arterial ulcers are painful and typically occur on the outside of the leg, heels, and toes. Venous ulcers, more common in people with varicose veins or venous thrombosis, appear on the inside of the leg and usually bleed. First sign, swelling of the legs, ankles, and feet. Swelling, edema, in the legs, ankles, and feet can be caused by a weak or enlarged heart, leading to fluid buildup in the body. You might notice your shoes not fitting, your sneakers feeling tighter, or your ankles feeling puffy. This swelling is more noticeable at the end of the day due to gravity increasing pressure on the veins in your legs. Elevating your legs can help reduce the swelling. Part 2. 7 symptoms of heart problems. First symptom, shortness of breath, dyspnea. Experiencing fatigue that's out of proportion to your effort, especially when you're overexerting yourself, can indicate a heart problem. Second symptom, persistent cough. A cough with white or pink phlegm could mean fluid in your lungs or air sacs, a sign of heart issues. Don't ignore it. See your doctor. Third symptom, shortness of breath when lying down. Needing more pillows to sleep better or having to sleep in a chair can indicate a heart problem. You might also wake up at night choking, known as paroxysmal nocturnal dyspnea. Fourth symptom, generalized weakness. Feeling tired all the time and struggling with everyday activities like climbing stairs or carrying groceries can occur when your heart isn't pumping enough blood to meet your body's needs. Fifth symptom, nocturia. Frequent nighttime urination can indicate heart issues, as excess fluid gets expelled during the night if the heart isn't pumping properly. Sixth symptom, intermittent claudication. Pain in your calf when walking, which improves when you stop, can signal poor blood flow and possible blockages. Seventh symptom, chest pain. Chest pain should always be considered a potential heart problem. It can feel like pressure, heaviness, tightness, or burning, and may radiate to other parts of your body. Part 3. The worst blood type for heart health. The blood type that poses the highest risk for heart disease is AB. People with AB blood are more prone to heart disease compared to other blood types. Research indicates that those with AB blood type have a higher likelihood of experiencing heart issues because this blood type is associated with certain clotting factors and inflammatory markers that can adversely affect cardiovascular health. Blood type AB is the least common, making up only about 4% of the population. Despite its rarity, it carries the most significant risk for heart disease, including heart attacks and heart failure. If you have AB blood, it is crucial to be particularly vigilant about heart health and to take preventive measures seriously. One reason AB blood type is linked to higher heart disease risk is due to its unique immune response. People with AB blood have both A and B antigens on their red blood cells, which can lead to a more complex interaction with pathogens and potentially higher levels of inflammation. Inflammation is a key player in the development of atherosclerosis, where arteries become clogged with fatty deposits, increasing the risk of heart attacks and strokes. Moreover, studies have shown that individuals with AB blood type have a higher tendency for blood clot formation. This can be particularly dangerous because clots can obstruct blood flow to vital organs, including the heart and brain, leading to severe cardiovascular events. Therefore, it's essential for AB blood type individuals to manage their heart health proactively, including regular checkups and lifestyle modifications to reduce risks. Understanding your blood type can be a critical factor in managing your health risks. Certain blood types, like AB, may require more rigorous monitoring and proactive management to prevent cardiovascular issues. It's essential to know your blood type and discuss it with your healthcare provider to tailor your healthcare plan accordingly. Knowledge of your blood type not only helps in emergencies, but also aids in long-term health planning. For instance, individuals with AB blood might benefit from dietary adjustments that reduce inflammation and improve cardiovascular health, such as incorporating more omega-3 fatty acids and antioxidants into their diet. Additionally, stress management techniques, regular physical activity, and avoiding smoking are crucial steps to mitigate the higher risks associated with AB blood. By staying informed and working closely with healthcare professionals, people with AB blood can take specific actions to protect their heart and overall health. Regular screenings for cholesterol levels, blood pressure, and other cardiovascular markers are essential to catch potential issues early and address them promptly. Taking these preventive measures seriously can significantly impact longevity and quality of life. Part 4. Heart-healthy foods. Eating for a healthy heart. Dr. Lee emphasizes that your diet plays a crucial role in maintaining heart health. Here are some key dietary recommendations. Reduce saturated fats. Cut down on saturated fats found in red meat, butter, and cheese. These fats can raise harmful LDL cholesterol levels, increasing the risk of heart disease. Instead, opt for unsaturated fats like olive oil and omega-3s found in seafood. Increase fiber intake. Eat more fiber-rich foods such as leafy greens, beans, lentils, nuts, and chickpeas. These foods help lower bad cholesterol by feeding healthy gut bacteria, which in turn improves heart health. Monitor salt intake. High sodium intake can raise blood pressure. Avoid salty snacks, processed foods, and canned soups, which can contain high levels of sodium. Instead, include foods like spinach and beets, which help lower blood pressure by dilating blood vessels. Control blood sugar. High blood sugar can damage blood vessels and increase the risk of heart disease. Avoid sugary drinks and limit candy and sweets. Focus on a balanced diet to maintain stable blood sugar levels. Part 5. Preventing heart problems. Exercise regularly. Physical activity is crucial for your heart and overall health. Low-impact exercises like walking, bicycling, and swimming can improve circulation. Quit smoking. Smoking is one of the worst things you can do for your health. It inflames arteries, forms fatty plaques, and increases the risk of heart attack, stroke, and dementia. Maintain a healthy weight. Being overweight raises blood pressure, worsens blood sugar, causes inflammation, and increases the risk of heart disease. Monitor your health. If you have a family history of heart problems, be more vigilant and consider additional tests. Watch your cholesterol, blood sugar, and blood pressure levels. Understanding and recognizing the signs and symptoms of heart problems can be life-saving. If you experience any of these signs, see a doctor immediately. Prevention is key. Exercise, eat healthily, quit smoking, and monitor your health regularly. Knowing your blood type, especially if it's AB, can help you take necessary precautions to protect your heart. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health tips and insights. Don't forget to share this video with your friends and family to spread awareness about heart health and the importance of knowing your blood type. Stay tuned for more videos from Dr. William Lee, and stay healthy.